So over the last year in this role, the first 12 months have been absolutely incredible, I have to say. And that is with huge thanks to the two directors of Bluebird Care who put their faith in me, knew they wanted a dementia expert, but didn't know where to find one, I guess. And by fluke, I met the lady who's now my line manager, which is Kim Teagle, who's our business operations manager, who also does all of our recruitment, and one of our other care managers. And they were invited by me to come and meet me at Dementia Cafe in Newbury, where I was working at the time, to see if they wanted to come and talk about Bluebird Care. However, when you meet people who are like-minded as yourself, who are totally passionate about dementia, passionate about making the lives of people living with dementia better, and to help them live well with this illness. Honestly, I had such a... I think they were supposed to be there for half an hour. They were there for well over an hour, and we were just sparking ideas off each other. So it was an incredibly organic meeting, and very, very productive. And that then morphed into several other meetings where I came and met the directors at Bluebird Care, Phil and John, and we sort of mapped out the role of a dementia advisor, dementia care advisor, and also what they wanted from it and what I could bring them. So, and happily, they offered me the role. So first 12 months have been incredible. I've talked about the customers that we have or have had, dementia customers who have really stood out to me personally. I've talked about our brilliant care experts, particularly I have to say about the living care experts, because I guess I know them better than I know our other care experts. But that's not to say there aren't some shining examples in our visiting care experts and care mentors. That will be a whole new video actually, so maybe I'll do that one in a minute. But this video I really wanted to talk about the dementia education sessions that I've done in the community over West Berkshire and also in North Hampshire, which is the entire area that I cover. And in particular, I wanted to talk about Dementia Cafe. So I'll finish off with Dementia Cafe, but I just want to briefly talk about the education sessions. We did a smattering of these in January, February and March in West Berkshire, and a few in North Hampshire as well. I find just keeping the number of attendees low, so 6 to 10, 12 people is probably the maximum number that I want. I don't want an auditorium. You know, I really want to keep it quite a close little knit group, because that is a more beneficial environment. It's an easier environment for family carers to come and talk freely about what they're dealing with and the challenges that they have, and also to ask for help. So, but it's also really good because if you have a smallish number of people, I also get local healthcare professionals, so people who work with people with dementia out in the community, same as me, doing a role similar to myself, or maybe a support worker role, attached to memory clinic, and they also come to my dementia education sessions. So it's a great way for them to come and learn a bit more. It's a different type of training that they get from an NHS training budget, I guess, but it's also good for them to get out and out of their normal environment, and also to come and meet more people looking after people with dementia. So it's a win-win all round. It's great for networking, but it's also really useful for them to participate in these sessions, as well as what I'm saying in the presentation that I'm doing. It's for them to chip in as well. So it was really good. My experience of having healthcare professionals at our ed sessions is really, really beneficial. And again, it becomes a bit of an organic session, so we get all sorts of different viewpoints, and it's great. It's really great. The discussions we've had have been excellent. So these education sessions, I hold them in day centres. I'm holding them in dementia cafes. I'm holding them in GP's surgeries with all, for example, the reception team. I've done one of those. So they can be anywhere that hopefully has an HDMI overhead projector so that I can screen my presentation, but it doesn't matter if there isn't one available. I walk them through my presentation and I talk to them about the points that I always talk about, and then I will email them videos or anything that we couldn't watch during the session afterwards, so that they can look at those in their own time. So it's really great to have that connection with new people looking after people with dementia, but it's also great to have that connection with other healthcare professionals in the same environment that I'm working in. So the education sessions have been really great. I've had existing customers, family members come to them. I've had people who have become dementia customers of ours and their family members. I have had local healthcare professionals, social prescribers, dementia support workers, memory clinic workers, a whole range of people. Volunteers in dementia cafes come and have this training too. So happy to say we're now doing round 2. So the first round was dementia education, but this second round is more about understanding dementia, understanding how it is with a person with dementia, and very much understanding how we all need, as healthcare professionals and family members, we need to change the way we communicate with the person with dementia. And also, I particularly want to stress how fantastic it is to use mindfulness. If you're a family carer and you're looking after somebody with dementia, mindfulness dementia is absolutely what you should be doing. So if you're keen to learn more about that, do get in touch. We're now starting to roll out the dates and the details of these new sessions of understanding dementia. They're all in North Hampshire this time round, so do get in touch with me. My email address is usually somewhere along the bottom of the screen or at the end when the video finishes. And get in touch with me or our office in Kingsclear and book yourselves in. I just need your email address and to understand who you're looking after, wife, mother, father, husband, whoever it is. And then we can have a chat when we do the dementia education sessions. So they are very beneficial. Do come along if you want to. The last bit of this video, I wanted to talk about Dementia Cafe. One of the things that the directors at Bluebird Care told me when I was first initially talking to them about a possible role here was that they wanted to open a Dementia Cafe. So that was always in their minds when I first started. And that was fine because I was already running 2 Dementia Cafes in Newbury. So, that's grist to my mill. So I had several other things I had to do first. I had to get the job entrenched. I had to familiarise myself with the team, not just the care managers in the office, but the whole Bluebird Care team. I had to meet the dementia care experts. I had to meet the live-in care expert. I had a lot of people to meet. And I've now completed, I think, all of our, we do dementia awareness training with all of our teams. So all of the team have had it now. I just need to now do the new care experts as they come through our recruitment process. So I do that roughly about once a month. So I think I've met everybody now who's actually hands-on care experts. So my next project was the Dementia Bus, which happened several months ago now, which was a great training exercise, not just for our care team, but also for other healthcare professionals in our area. We can all learn so much more about dementia. There is no, we know all this and you don't. It's more about if you want to learn more and learn a better way of doing the role that you're doing, come to our training. So that was really useful as well. Some incredible discussions were around the training table with the healthcare professionals. It was an excellent morning. So Dementia Cafe was my next project, if you like. And we launched, it took me a couple of months to do all the prep, but we launched, our grand opening was in May. Very privileged to have the Mayor of Hungerford come along to open the cafe. to ceremonially cut our very first Dementia Cafe cake, because when you come to Dementia Cafe, there is always cake. Cake, biscuits, tea, coffee. So we had a special cake made, bluebird cake made, and she came along to cut it. So the whole cafe was done as, it's a partnership between ourselves in West Berkshire, Bluebird Care West Berkshire, but also with Age UK Berkshire, Dementia Friendly West Berkshire, which is an organisation that I've worked with for 2 years now. And I'm still working with them in this new role I have with Bluebird Care. So it's a very joined up situation now in West Berkshire. And it really works, having lots of dementia healthcare professionals meet on a regular basis with other people in the local council, other people in the local dementia field, should we say, to just pool resources, pool ideas, think up things that we can suggest for our local area and to just make it happen. So it's really useful. So partnering with Dementia Friendly West Berkshire, Age UK Berkshire was huge for us, because they are doing what exactly we want to be doing. So all of the things that we're already doing, we can now join forces with Dementia Friendly West Berkshire and do it as a team. So it's perfect marriage. So we are running Dementia Cafe together. And a lady called Sue Young at Age UK Berkshire has been instrumental in doing all the legwork with me, going around the different venues in Hungerford to try and find the best one that we could find. And we came up with the Bear at Hungerford, the Bear Hotel at Hungerford. It's in a central location. It's perfectly suited to what we want. It's dementia friendly, and the Bear Hotel, Green King, are very keen to do more in the community in Hungerford. So it's a win-win for all of us. So we're now running monthly dementia cafes. We started in May, that was a launch. In June, we had a local artist called Helen Mortimer who came to make easel cards with us, which are absolutely stunning. I'm an artist myself, so the colours that everybody was using were beautiful, but it was also the application of the people with dementia focusing on what they were doing to make their card perfect. That was so lovely to see. And the way that people with dementia chatted with other people with dementia around the table, the family carers got to talk to other family carers. It's just a win-win all round. You can see why we're doing it. So it's an opportunity, these cafes, for people with dementia and the family carers to come along, meet others in the same situation, come along and do something fun. As I say, June was art. July was our quiz, so I became quiz master for the day, and that was just a real hoot. It was a very enjoyable session, went down extremely well. We had a lot of fun. We even had a couple of our care experts and our care team singing, because we were having music songs as well, so they were singing the lyrics. These people in the office have just unfathomed skills that we're going to get them out, and I'm going to get them come back to Dementia Cafe and maybe do some more singing. One of our care managers in the office I think is in a band, so when we do another quiz, I'm going to do a music round, and this lovely lady is going to come and play her guitar and sing and get people to guess the song. So you heard it here, folks. It's a stop press, hot off the press announcement, but we'll be doing that in future. So Dementia Cafe is a lot of fun. Come along. Just drop me an email. Say, my name is so-and-so. I'd like to bring my mother. She has dementia. My father, whoever it is. And come along for a fun and enjoyable session to meet others. And just feel a bit more relaxed about the whole dementia thing. That's what we are aiming to do, to help people reduce the stigma and help people's awareness of dementia. And just while I'm here, the next session we're having is actually a week today. Whether you'll see this before or after this next Dementia Cafe, I don't know. But we're having a wonderful musician called Dr. Fernando Aguera, who has come to Dementia Cafes that I've run frequently in the past. It's always a soothing session. He brings along his acoustic guitar, and he is a music teacher himself. but he just loves coming and giving something back. So he comes along and plays us beautiful music. Theme from The Deer Hunter is one that particularly has stuck out in my mind. It gives me goosebumps just thinking about him playing it. But he sometimes introduces the pieces, and other times he says, I want you to guess what it is. So that gets everybody's cogs whirring, which is again the whole point of this. But the thing about music and dementia cannot be overstated. The one thing that resonates with all people with dementia is music, because it evokes memories of when they first heard that song, what it meant to them in their childhood. You know, it gets into parts of their head which other dementia cafes can't reach. That's a Carlsberg ad, by the way. That's nothing new that I've dreamt up. But it's fun. It's getting them out. It's getting them to meet others. Come along for some lovely music. I think our next session in September is art. So we're doing some art with another local artist. And then I think we have another musician session. And then we're going to finish with a very Christmassy, arty, crafty session with Helen Mortimer again in December. So, and in between there somewhere, I think I'm doing another activity session, not a quiz, we'll do that probably in the new year, but another activity session that I've got up my sleeve, which I think will be a lot of fun. So do come along, drop me an email, come along. This is what I do. All of these things are what I do. I don't know how long I've talked this morning, at least an hour or 2 hours, but I know my phone battery is dying, so I am going to finish now. But I just wanted to explain the highlights of what I've done over the last year. I'm not going to cry. I think you can see the impact that it has on me. I absolutely love this job, and I'm so grateful to the directors and Kim for giving me the opportunity to do it, to help train so many people in dementia awareness. That ticks all of my boxes. Meeting all these incredible care experts who are out there every day supporting our dementia customers. My hat's off to you. We have some brilliant care mentors and some brilliant care champions, and come along to a dementia cafe and meet them, because it's a fun event, but it's also about you meeting us and us meeting you. So do come along, come and sit and have a chat. Always happy for anybody to come along and see what we do. I couldn't be happier. Here's to the next year. Thank you.